Hello and good afternoon, everybody. We are back with yet another Master Series webinar for 2021. Our guest speaker for today is Dr. Abhijeet Salunke, who is consultant orthopedic oncologist at Gujarat Cancer Research Institute in Ahmedabad. He is an expert in orthopedic oncosurgery, musculoskeletal oncology, and has been treating the patients of bone sarcoma with great compassion. He has over 70 publications to his name and also holds positions as expert reviewer in 20 journals. Today, he is going to highlight the radiological assessment method A to Z for bone tumors. We are delighted to have you, sir.
Yeah, good morning. Thank you very much for giving an opportunity to me to be a speaker on Docplexus. So I'd like to share my screen and we can start a presentation. Good afternoon. So we will be like to have today's presentation on A to Z RAM. So what is the meaning of this A to Z RAM? It's a radiograph assessment method for bone tumors, and it's a useful guide for orthopedic surgeons and radiologists. And this whole work was conducted at Gujarat Cancer Research Institute, Ahmedabad, India. So this is a webinar on Docplexus, and it's A to Z RAM, radiograph assessment method for bone tumors. So why we need a method to diagnose a bone tumor? So on the left side, we can see an X-ray of femur with some lesion involving the proximal part of the femur, which is osteolytic and looks ill-defined. And on the right side, we can see Mr. Amrish Puri, a veteran actor from India. And there are two images of him. One, he is a villain, and one, he is a hero or supporting actor. So we want to differentiate whether it's a benign tumor or malignant tumor, because the plan totally remains changed for both tumors. If it's a benign tumor, benign Amrish Puri, the plan is totally different. He will be helpful to you. If he is a malignant, he is a villainous Amrish Puri, then the plan is totally different. You have to fight against him, and then the hero has to win the fight against this villain. So just we'll keep this X-ray in our mind. And what is its diagnosis on X-ray? Sorry for the poor quality. So this was the referred X-ray what we got from the patient. So again, on the left side, we can see some lesion into the femur, and it was osteolytic, ill-defined. And on the right side, we can see that this patient was treated inadherently with a nailing fixation. So a nail was put, and the swelling increased in size. So the treating surgeon thought that something is wrong, and he referred this patient to our cancer care center. So it was thought to be a benign tumor by the first treating doctor, and it was wrong assumption from his side, and he had put nail. So it was a sarcoma, so a malignant bone tumor which was treated inadherently and inappropriately with a nailing surgery, and the tumor increased in size. So again, same analog of DDLJ. So Kajol has missed the train. She was unable to catch with Shah Rukh Khan, and she was left on the platform. And again, we had to bang our heads on the walls, because if it's a sarcoma which was treated inappropriately, and it becomes very difficult to treat these patients. The limb salvage surgery means saving the leg of the patient is very difficult. You can get many multiple complications in these surgeries, and the overall prognosis means the survival rate of these patients become very poor if it was treated with inappropriate surgery. So this patient came to us, and we did his CT scan, MRI, and a biopsy was performed for him, and it was diagnosed as Ewing sarcoma. So Ewing sarcoma is a type of tumor which is a sarcoma, and it was treated with neoadjuvant chemotherapy. So on the right side, we can see the X-rays of the same patient, and it is very well defined now. It has given very good response to chemotherapy, and we thought that we can attempt limb salvage for this patient. So planning was done, and we planned for a total femur surgery. So means that we will excise whole of the femur, resect it, and put artificial prosthesis. As it was a growing kid, we had to put prosthesis which will grow according to the size of the patient. Means the patient's height increases, and the prosthesis length will also increase in length. So again, we'll see the previous X-ray. So this was the X-ray on presentation to the initial surgeon. On the right side, it is an X-ray with the nail, and this is the X-ray after chemotherapy. So a term is there, rodded sarcoma, means putting a nail or plate in a patient with sarcoma, malignant bone tumor, with a nail or plate without proper diagnosis and without proper histopathological studies. So what can be the two treatment options here available? One is limb salvage, means saving the leg, or amputation, so cutting the leg. So the surgery was planned for this patient, and we can see here there is a biopsy scar which was marked with a red marking line. So it was the whole incision, and we excised the tumor with good margins, so the tumor was excised. And on the left side below, we can see the cut specimen of this patient. So the tumor was cut, and we were able to assess the margin. So it was very well defined tumor, good response to chemotherapy, and resected very well with good surgical oncological margins. So how we reconstructed it? We reconstructed with a prosthesis that is called expandable prosthesis. It's a minimal invasive method for this prosthesis. So we have a short video. So here we can appreciate everyone is pointing towards the expanding area of the prosthesis, and we are unturning the screw heads. So 10 turns will grow the length of the leg into 1 centimeter. So we are pointing an artery towards the growing part, and we are unturning the screws, and this part will expand in this length. So this was the surgery performed for this patient. Again, a second case, a gentleman with a lesion into the femur. Again, it was misdiagnosed as a benign tumor, and nail was put for that patient. And this patient presented with us to this big swelling. So it was not able to salvage this patient. He had presented with multiple lung mets. So he was treated with palliative treatment. So we couldn't save this patient. A third example, X-ray on the left side showing a fracture of the femur. So it was diagnosed as a pathological fracture of the femur, and nail was put by the surgeon. And again, it turned out to be a sarcoma. So she was a 55 years female presented to us with a rhodded sarcoma. So again, sarcoma with a nail inside without proper diagnosis. Again, limb salvage was not possible for this patient, and we had to cut this limb of the patient. So external hemipelvectomy was performed for this patient. So can we prevent these types of hazard in our treatment? Yes, they are preventable if we plan the treatment very well and execute it nicely. So this is the term rhodded sarcoma, a tumor which is thought to be benign or metastatic. Nail or plate was put, and the final histopath is osteosarcoma, Ewing sarcoma, or chondrosarcoma. Another term is OOPS surgery. So the surgeon says it's OOPS, what we had done for this patient, and it was a sarcoma. So can we prevent it? Yes, we can prevent it. And again, the surgery is limb salvage or amputation. So we'll go by a scenario. So a patient presents to any clinician, an orthopedic surgeon, a general surgeon, or physician with this swelling, and we can examine this patient clinically, and there is a lesion or swelling into the distal aspect of the radius. The skin over the swelling looks tense and shiny. The swelling is extending on both aspects, volar and dorsal aspect. We'll ask the history to the patient. So it's a pain and swelling over the left wrist for 6 months duration, and we'll plan the treatment for this patient. So we have got an X-ray done. So how we should read this X-ray? That is very important. We are having multiple patients in our OPD, and the exact findings can be missed, which may lead to the diagnosis for these patients. So we have performed the X-ray and MRI. We'll see how this X-ray can be read. So these are the investigations required for the management of the patient. So we will be discussing today only about plain X-rays, and in the subsequent lectures next time we can have session on blood investigation, MRI, steps of biopsy, and other investigations. So today we will be focusing only on plain X-rays. So on X-ray, we have this is a busy slide. We can see if we are seeing an X-ray, we should know the age, gender of the patient, whether it's a single or multiple lesion, location of the skeleton, which bone is involved, which part of the bone is involved, whether it's epiphysis, metaphysis, diaphysis, whether there is periosteal reaction, soft tissue mass, border, bone restriction. So it's very difficult to remember. Any resident doctor who is seeing a patient, or any consultant who is seeing a patient, on exam this question is asked, what is the diagnosis of patient? We are just jumbled. What is the diagnosis of the patient, and difficult to treat. So we thought that we'll make this busy slide into a simple thing which can be easily used. So we published our data as a proposed A to Z RAM, that is radiograph assessment method for triage of patients with suspected bone tumor. So this paper was published in a PubMed Index journal, that is Radiography. which was published a few months back. So it was published in January last month only. And these are all my co-authors. So Kunal Nandi is there, Mayur Kamani is there, Ketul is there, Dr. Subodh Pathak, he is from Ambala, Dr. Keval Patel is there, Dr. Bhalera is there, he's an engineer who has associated with this project with us, Dr. Abhishek Jain, Mohit Sharma, Vikas Wariko, Suprit Bhatt, Priyank Rathod and Shashank Pandya sir. So all were the co-authors for this paper. So we will be discussing what is this method and how it will be useful for our clinicians, orthopedic surgeons and radiologists. So we thought that we'll make it is a simple method. So that is A, B, C, D, E, F, Z. So what we have learned in our childhood, all the alphabets, A, B, C, D, E, F, Z. So it will be difficult to miss any points of this, and we can reach some diagnosis and treat the patient in a better way or better manner. So A is the age of the patient, that is skeletally mature or immature. B is the bone, which bone is involved, long bone or flat bone. B, which part of the bone is involved, epiphysis, metaphysis or diaphysis. C is the characteristic, osteolytic, osteosclerotic or mixed lesion. C is the content. D is distribution, whether it's a well-defined or ill-defined tumor. E is exterior of the bone, periosteal reaction. F is the fracture, and Z is zone of transition. So it's the easy mnemonic A to Z, and we can use it in our busy clinical practice. So we had prepared an algorithmic approach for any patient. So again, this was published in the same journal for this paper, and we can have the history of the patient, get blood investigations done, and read the X-ray according to this method A to Z. And we can separate or differentiate the patient into a benign tumor or malignant tumor. So these all findings can be suggestive. So again, I will insist the word. These all findings will be suggestive of a benign tumor or malignant tumor. So your treatment plan can be based on this, but you can complete this treatment basically based on only X-rays. So it will be a good guideline for the treating physician that this is suggestive of a benign tumor. So this is the treatment, and this is suggestive of malignant treatment. So this will be the treatment. So all it's is suggestive of a benign tumor or a malignant tumor. So we will like to see few examples. So X-ray on the right side, we can see a lesion into the femur. So the black triangle showing the physis open. So it's skeletally immature person. Then we can see bone, which bone is involved. Here it's a femur bone, metaphysis or diaphysis. What is the characteristic of the tumor? It's an osteosclerotic lesion with a white triangle. It is having osteoid matrix with a cortical dissection. It's an ill-defined tumor. We are unable to differentiate where the tumor is starting and where it's ending. So it's an ill-defined tumor. Exterior. So you can see the black line with two arrowheads. So it's a sunburst type of periosteal reaction with a Codman's triangle. F is for the fracture. So white line suggesting it's a fracture. It's a pathological fracture. And all these findings suggest that it's a malignant bone tumor. So again, we will summarize. It's A, age, skeletally immature. B, bone. Which bone? Femur, metaphysis and diaphysis. It's an osteosclerotic lesion with osteoid matrix without cortical dissection, which was ill-defined, with a sunburst type of periosteal reaction, with a pathological fracture, with wide zone of transition. So all these findings suggest that it's a malignant bone tumor, and most probably it's a osteosarcoma of femur. So second example, we can see a lesion in the proximal femur, and it's well defined, skeletally mature person involving the femur, metaphysis or diaphysis, osteolytic with no content, without any cortical dissection and without any periosteal reaction. So all these findings summarize that it's a benign bone tumor, and most probably it's a giant cell tumor of the femur. Third example, skeletally immature person. We can see this X-ray. It's a skeletally immature. Physis is open. The white big triangle showing periosteal reaction. It's osteoid matrix, ill-defined lesion. So again, we can summarize. It's a skeletally immature. Humerus is involved. Epiphysis, metaphysis, diaphysis, osteosclerotic, osteoid matrix, cortical destruction absent, ill-defined lesion, periosteal reaction present, pathological fracture is absent, and a wide zone of transition. Again, to summarize all this with the help of A to Z RAM method, It's a malignant bone tumor. Fourth example, lesion into the finger, which is again well defined with a pathological fracture. So most probably a benign bone tumor, most probably a enchondroma or giant cell tumor. So what is advantage of this method? We have seen all these four examples and we are suspecting it's a benign bone tumor. So we published this also, pyramid, which can be easily and helpful. So we are having a signal method. All at our roads are having signals. So there is a green signal for go and there is a red signal for stop. So for green signal, we can have X-ray and it's a benign bone tumor. So the treating physician can get MRI done and biopsy as per the lesion, as it's which type of lesion is. And if it's a malignant bone tumor, it's always a good idea get a MRI done and refer the patient very early to a tertiary cancer care center, because the treatment plan depends totally on what is the management. So the treating surgeon should know what is the plan, what is the biopsy should be done, where the biopsy should be done. So it's very good idea that refer the patient, if it's a malignant bone tumor, to a tertiary cancer care center which is nearby your area. When it's a benign bone tumor, you can get a MRI done, biopsy if required as per the lesion. Few tumors don't require biopsy, like osteochondroma don't require, osteoma doesn't require a biopsy. If you are suspecting it's a simple bone cyst or aneurysmal bone cyst, you can get biopsy done as per the tumor. So it's very good idea. Green signal is for go and red signal is for stop, and refer the patient very early to a tertiary cancer center. So we'll see few examples. Again, a lesion into the distal end of the radius, looks well defined. Again, apply our formula of A to Z. It looks benign to us. So get a MRI done, get a biopsy done. This was a giant cell tumor. Second X-ray showing a lesion into the tibia. Again, apply our formula A to Z. Skeletally immature, ill-defined, osteosclerotic, wide zone of transition, looks malignant. So again, MRI was done and it was osteosarcoma. Third example, quite big lesion involving the tibia. Again, osteolytic, well defined, no periosteal reaction, so most probably a benign bone tumor. So again, MRI was done. It was a giant cell tumor of tibia. Fourth example, same like the X-ray which we have seen few slides before. Last X-ray, again a lesion, skeletally immature, soft tissue mass present, ill-defined, involving the diaphysis and metaphysis, periosteal reaction. So for this patient, we did a MRI. It was osteosarcoma and was treated with neoadjuvant chemotherapy. So again, to summarize, this is very important pyramid. Suspecting a benign bone tumor, get a MRI done, biopsy as per the requirement, and the bone lesion. If it's a malignant bone tumor, just do a early referral, get a MRI done, and refer it to a tertiary cancer center for next management. So what are the implications of the practice for according to this method? So A to Z RAM, it's a radiograph assessment method which is reproducible. So if multiple doctors are using it, we think it's reproducible, and we have done inter-observer variability for this study, and 4 doctors were involved, 2 orthopedic oncosurgeons and 2 oncosurgeons, and it's a very reproducible method and it is easily used, can be used for in the outdoor patient department. It can aid for better management. So if you are suspecting a benign tumor, you can get an MRI or a biopsy done. If it's a malignant tumor, you can get early referral for this patient, so you don't waste time in his management. And it's a medical triage method. So triage means that you want to refer or treat a patient which is well treated very at your center. So it's basically a method used in war-like situations where the person is injured and you want to do triage of the patient. It can subdivide patients according to the probable diagnosis. Again, I would like to insist, it's a probable diagnosis and you can have success in multiple methods, but this is a easy method, and you can divide the patient into a suspected benign lesion or suspected malignant lesion. So thank you very much for your kind listening, and if you have any queries, just you can email me to, this is my email address, it's bonestumor@gmail.com, or you can visit me at my website bonetumor.co.in. So thank you very much, and it was nice to have a session on Docplexus.
Thank you so much, sir. The entire webinar was very interactive. And in case we have any questions from our viewers, we'll get back to you, sir.
Yeah, thank you very much.